Great, thank you, David. Thank you, Brian, for inviting me to this session. And I'm pleased to be able to provide some background information that hopefully will inform this debate and the discussions that we're going to be hearing about. What I wanted to do is tell you a little bit about the things that FDA has been considering with the stakeholders involved in the development of these devices, some of the challenges and opportunities that we see related to the development in review and regulation of these technologies. But before I get into that, I thought I'd give you a little bit of the perspective of the Center for Devices and Radiological Health when it comes to medical device development. So a few years ago, the CDRH leadership took the opportunity to rewrite its vision. And as the first prong of that vision, it states that patients in the U.S. have access to high-quality, safe, and effective medical devices of public health importance first in the world. And we recognize that that is somewhat aspirational. It certainly is a challenge to bring medical devices to the U.S. marketplace. However, what this is truly a commitment on behalf of the Center for Devices and Radiological Health and working with its stakeholders to not lower the evidentiary standards for getting safe and innovative devices to the market, but rather for understanding what we can do to make efficiencies occur in medical device development so that medical device development occurs here in the U.S. so our patients can be the first patients to experience the benefits of these technologies. And so in trying to foster that innovation, FDA and CDRH has taken the approach of holding several public workshops over the past couple of years. And RAST, or robotic-assisted surgery devices, was one of these workshops that we recently had. And it occurred back in July, and it brought multiple stakeholders together. And I think it was a good realization of everyone that actually we all have a role to play, and essentially we're looking for the same end goal. We just have different responsibilities in assuring that that happens. And in preparation for this workshop, our team developed a background paper. My last slide, I'll give you the link to some of that information. But they identified 6 challenges that we wanted to discuss at the workshop. And these are challenges that had kind of bubbled up in our deliberations internally within FDA and in talking to our stakeholder groups. And there were 6 challenges discussed. I've kind of focused on the last 4. To mention the first 2, those first 2 challenges were more related to engineering type issues. For example, with market entry and iterative changes to a medical device, what is the level of engineering, the level of validation testing that needs to be performed to assure that sufficient confidence exists before a device enters the marketplace? And with respect to interoperability, we are seeing medical devices that are not robotic-assisted surgery devices that seek to be compatible with a robotic surgery device platform. And so it's one thing when these manufacturers work together with the robotic surgery device platform so that they iterate and continue to be compatible with the platform as both of the technologies evolve. But when you have 2 different manufacturers, the RAST manufacturer as well as the third-party manufacturer working separately and not having a relationship, how do we assure that as iterative changes are made, that the compatibilities between those 2 technologies exist in the same way that they existed originally? And what we would hope to see in the future, is multiple RAST platforms present. And the question that was posed at the workshop is, to what extent do we want to see interoperability among these platforms? And so those are the types of things that we're thinking about now. With respect to the things that are in the box, I have slides related to all of them, with the exception of training and simulation as a risk mitigation measure. So I'll mention that here briefly, and that is that FDA recognizes that training is important to overcome the learning curve associated with mastering RAST technology. And it underscores the need for this training. However, FDA does not accredit training programs. We don't provide certification to surgeons to assure that they are trained in the technology. We see this as a shared responsibility with, among the device manufacturers and with accrediting institutions and bodies to assure that the surgeons using these devices are using them in the way that they were intended, in the way that we know can deliver safe and effective results. And so I want to get into general claims and specific procedure claims just a bit, because it is a confusing topic. And the first thing I need to make sure that I always like to tell every surgeon audience is that FDA, Center for Devices and Radiological Health, regulates medical devices. We seek to assure that the labeling and advertising, the marketing associated with these devices is truthful and accurate. We do not regulate the use of these devices by surgeons in your operating rooms as you're delivering patient care. We're not regulating the practice of medicine. So a lot of these devices, RASTI is no exception. You know, we have medical devices, a laparoscope, for example, that is cleared with a general claim, like for use in general surgery. And the question is really, what does that mean? You know, if you have a robotic surgery device and that's cleared for use in general surgery, what does that mean to the end user? And it basically means that the device is capable of accessing the places that a general surgeon would likely need to use the technology. It can reliably function in a way to cut and suture and perform the tasks necessary to conduct a general surgery procedure. Now, there is an interest by manufacturers to indicate their devices for specific procedures. And so that gets into the question of how much evidence is necessary to justify a specific operation. And unfortunately, in that situation, there is not a hard and fast rule. It depends, is really what we came out with. It depends on the complexity of the procedure and the risk of the procedure. It depends on whether or not it's essentially a tool claim that it can accomplish a orchestrated set of movements to, say, remove an appendix, or if it's seeking to actually perform treatment claims, for example, a treatment for a cancer, where we think perhaps more evidence is necessary in those scenarios. So I think with that, I want to move on to another aspect of our discussions, and that was that we want to foster innovation, and doing that in the pre-market space is one thing, but we can also leverage the post-market information that we may be able to obtain regarding these devices. And if we had a post-market system that was able to quickly tell us that adverse events were happening, so we could be more nimble about our response and address them quickly, so we could make iterative changes quickly in the pre-market, that would certainly be the ideal situation. And so what CDRH has been doing is been thinking about ways to modernize our post-market surveillance system. And we see on the periphery a lot of our standard ways of assessing these technologies in the post-market. And what we're proposing are the two central themes. And that is, the first is a unique device identifier for every medical device. This would be like a barcode or a unique number that would accompany the device and be integrated into electronic health records, so that that streaming data is used for multiple purposes already and also is capturing information regarding device use. And we also see, as another core aspect of this program, the use of registries, national and international registries. Now, this wouldn't be for every device in every situation, but we think that there are opportunities to be able to leverage the information, and we've had success in doing so with some of these registries, especially in the cardiovascular and orthopedic surgery arena. So to talk a little bit more about pre-market and post-market and the balance between the two and the use of registries, I want to emphasize that we're in the post-market, there's an opportunity to look at real-world use of some of these devices. And we understand that healthcare providers are going to want to care for their patient, and in the care of their patient are going to want to use some of these devices in ways that we hadn't expected them to be used. And in some cases, even using them off-label. And you know, there's restrictions on what we can allow with respect to advertising these uses. However, what we don't want to lose is some of the information gained from this innovation that's occurring on a case-by-case basis in this real-world use. And perhaps if there's information that is obtained from these perhaps off-label or novel uses of these devices, perhaps they can become on-label to help inform other providers and patients of the different ways that they may be able to use this technology. And there's been instances where we have leveraged registry data to support expansion of pre-market claims for medical devices. So we see this as a great opportunity. So I think with that, I just wanted to leave you with some links that I thought may be of interest to you. You can find much more information regarding our workshop at the link, at the first link. I also wanted to call out FDA's CDRH, our epidemiological network that also talks about pre- and post-market registries. And notably, the American Hernia Society Quality Collaborative, many of you already know that this is a quality collaborative initiative that was created by surgeons for surgeons in the care of their patients to optimize, to understand how to optimize outcomes related to ventral hernia repair using mesh devices. And it's my understanding that they have enrolled about 8,000 patients so far, and we're hoping to be able to use some of this real-world experience to be able to inform our pre-market review and regulation of these technologies, and in some cases expand the indications for these technologies. So with that, if you have any questions, please feel free to contact me. And again, thank you very much for being able to provide some introductory remarks.